So in this video, we're going to show you how XDcuff Economy version is installed and deployed from your Stryker stretcher. So before we install the restraints, you want to make sure that you have your cuff securement straps installed already. If you have not done that, you can go to our YouTube channel and see that video. So we're going to start here with the left wrist position. This is located on the foot end of the stretcher, which is going to go around the 2 lift bars here. So you loop the stretcher anchor around and feed it back through itself. Now ensure when this is applied that it's facing out towards the provider, so when it's released from the cuff securement strap here, you'll have easy access to the pull tab. Your alternate left wrist position. Bring the stretcher anchor through itself. Again, you want to make sure the buckle is facing out. That's it. So unlike the reusable version, the disposable version is universal, so it fits on both the wrist and ankle. So now we're going to install the right ankle position, and if it's confusing you why I'm pointing to this left side, it's because we crisscross the restraints, and I will show you how that goes on later. So again, loop the anchor, feed it through, and secure it snugly within the cuff securement strap. So now we're going to go with the most important part, which is the deployment. So before you deploy XDcuff, it's always important to have the stretcher harness on, just like any patient, but even more important with the uncooperative patient. Another good strap to have is a strap just above the knees, which is great to reduce the chance of the patient kicking. Obviously, you're still going to want to use the ankle restraints, but this is a great way to prevent a lot of the motion you have. So we'll start with the left wrist position. Remove the cuff from the cuff securement strap. Remove the protective packaging. Release it out. So you want to ensure before you attach it to the patient's wrist that there's no twist in this strap, and that will prevent the chance of the strap getting tangled in the buckle. So it's easier for me to put the cuff around your own wrist, grab their wrist, loop the restraint over, secure the gray tab, and pull out the slack. You want to ensure there's at least one loose finger space between the cuff and the patient's extremity as to not interfere with circulation. So once that's done and you have them in the position you want, you can cinch it up. So if you do happen to have a twist in the strap when you do that, all you have to do is just pull a little bit harder and it'll pull through. When you get out to the hospital, or if there's an emergency, the good thing about XDcuff is the quick release buckles. You can quickly remove them and transfer them to the hospital bed or backboard. So another thing you can do if you want to prevent the patient's arm from coming too far out to the left, you can undo the buckle and go through this hole in the side rail here and cinch it up. And that'll prevent them from coming further to the left. So now we're going to deploy from the optional left wrist position. Unstrap the cuff securement strap, so we'll release the cuff. Roll the restraint. So now we can do the right wrist. Move the protective packaging. Loop the cuff around your wrist. Grab the patient's wrist. Loop the cuff around. Attach the Velcro tab. Move the slack. Cinch it up. So this is usually sufficient to restrain an individual, but some departments actually like a little bit more restriction. So what some of them will do is put the buckle through the skin on the stretcher frame and plug it in. So as you can see here, there's a little bit less motion there. So now we'll do the ankle restraint positions. Obviously you wouldn't want to be standing near the patient like this, but this is just for demonstrational purposes. The cuff. Twist in the strap.
So we developed these restraint positions based on what we were taught in school and what works best in the field for us. As you can see in this video, we use the right arm up and the left arm down example. This can be interchanged depending on your stretcher's position, ambulance layout, or preference. Final patient positioning should be determined by your lead medical authority, as this is just a recommendation based on user feedback. If you have any questions or suggestions, please leave them in the comment section below. Thank you for watching.